Hi, Dr. John Torres here with NBC News on this Facebook Live, covering some of the headlines that happened over the weekend and last week, getting you some information behind those headlines so you have a better understanding of what that information means, and particularly what it means for you, your family, your loved ones, and your community, and hopefully send you away with a little bit of information that can help you get through this pandemic happier, healthier, and hopefully sooner than we normally would get through a pandemic like this. And we're doing a good job. We just need to do a lot more to get through this pandemic as soon as we can. But the headlines I want to cover today include and after the headlines, I go ahead and take your questions. So if you have questions, please send them our way so I can go ahead and answer as many of those as I can. But let me cover the headlines here. First, I'm going to talk about the variant. And you've probably heard some news about the variant that's here in the U.S., the variant that's around the world, and what that means for you, the vaccine, treatments, and what it's going to mean going forward in the future. On top of that, we're going to talk about the vaccine and the distribution and how it's not working as well as we'd like, but there's certainly some news on the horizon that will hopefully help out. And then double masking. That's been something that's out there. Do you need to do that? We'll talk about it and what the experts say and what they really mean when they talk about double masking. So first, let's talk about the variant itself. As you know, there's a variant that started off in the UK. It's called the UK variant, B117, its official name. We call it the UK variant because it started off in the United Kingdom. They started noticing this back in September timeframe, a little bit here, a little bit there, and then all of a sudden by December, it became the dominant strain in parts of the UK, particularly southern UK and the London area, and now it's become the dominant strain across the United Kingdom. Well, the reason that's important is because they have found out this strain is more contagious. It's more infectious. In other words, you're more likely to catch it and spread it to other people than you would the other strains of coronavirus. Now, to put it in perspective, these variants happen on a regular basis. Viruses, like the coronavirus, constantly mutate. If they mutate enough and they get what's called an advantageous mutation, in other words, something that helps the virus either thrive or live or infect better, then it becomes a variant. And in this case, the UK variant, was noticed in the UK, has spread throughout the UK, and started to spread in other countries. Well, other countries started trying to cut off the UK from traveling to their country, but by the time, as I said earlier, it's almost like shutting the barn doors after the horses got out. This has already got out around the world. Here in the US, we know it's already here, and by some estimates, it's going to become the dominant strain by March timeframe, so just a little over a month away. And what does that mean for us? Well, number one, it is more contagious, but on the good side of the coin, it doesn't appear to be any more deadly. However, the more people that get it, the more people are going to die from it. So on a one-to-one basis, it might not be more deadly. If I get it, I might not react in that way to that virus versus that variant versus the other variants. But if enough people get it, then just by sheer numbers, you're going to have higher numbers of death go up as well. And so that's why it's concerning. That contagious nature, a lot of people are looking at, okay, are masks sufficient, social distancing sufficient? At this point, they look like they're sufficient. Now, there's another variant out there. It's called the South African variant. And it's very close to the Brazilian variant that's out there as well. So basically, most experts just label it the South African variant. The concern about that is more contagious and possibly more dangerous as well. And so that's why they're keeping a close eye. But luckily, it's still contained to that area, and particularly South Africa hasn't really traveled across the world, but it has the potential to do that. So a lot of countries, including the United States, are restricting travel from South Africa and from other countries that might have the South African variant to make sure it doesn't come here. But now, kind of blending this in with the vaccine, what does this mean for vaccine, and what does it mean for the virus itself? Well, earlier, a couple days ago, Boris Johnson, the Prime Minister of the UK, said that by some indications, the UK variant was proving to be more deadly. Other experts got on and said, wait a minute, we don't have that information yet. This is very preliminary information. And one expert put it in perspective. He said, basically what we're seeing here in certain age groups, particularly those that are a little older, it looks like if you get this one, instead of 10 out of 1,000 people dying from it, you could have 12 or 14 out of 1,000 people dying from it. So it does bump that death rate up a little bit, but not that much. And so it looks like, again, it's more contagious, but not more deadly, at least at this point. The South African strain, on the other hand, looks like it's more contagious and could potentially be more dangerous as well. The other variant, what happens with the other issues, what happens with our treatments, what happens with our vaccines? Well, over the last couple of days, Pfizer and Moderna, which are the two biggest vaccines we have, the only vaccines we have here in the U.S., are both saying it looks like our vaccines can handle the UK strain. The South African strain we're not quite as sure on, so we're keeping a close eye on that. As a matter of fact, Moderna came out saying when they tested their vaccine against the UK strain, it did fantastic. Antibody levels stayed high. However, when they tested it against the South African strain, those antibody levels dropped, meaning that the vaccine wasn't able to handle the South African strain quite as much, but it didn't drop so much that that vaccine was not effective. It was still proving to be an effective vaccine, just not as effective as it was against some of the other variants that are out there. And if you remember last week, Dr. Fauci had talked about this on air, where he said that what we're talking about here is what's called the cushion effect. So these vaccines are so effective, 95%, that even if they drop a little bit to the 80 or 70%, they're still going to protect us from getting the virus, and importantly, protect us from getting complications and illnesses and dying from the virus, which is overall important. So again, looking at the vaccines here, it looks like they're going to work. Treatments, for the most part, looks like they're going to work against the UK strain. The South African strain is a bit of a different story and a bit more concerning, but everybody's keeping an eye on it. One of the bigger issues here in the States is, are we keeping a close enough eye on it? And that has come up over the last couple of weeks because our surveillance system, looking for these variants, looking for these changes in the strain, aren't as robust as we'd like them to be, and we're making them robust as days go on because we want to catch these before they start spreading, because once you catch them, you can isolate them and hopefully stop the spread. And the honesty of it is, the way these variants work, the way these mutations work, is by the virus getting in our body. So if we can stop the virus from getting in our body, then we can stop these mutations from happening, we can stop these variants from appearing, and hopefully we can stop these things from causing more and more problems. Now, looking at the vaccine itself, as you know, and you've probably heard, the vaccine distribution is ramping up pretty well. We're getting a lot of vaccine across the country, but the administration of the shots is an issue right now. And so what the Biden administration has said is, we're coming in here and we're going to start giving the states a lot of help. A couple of things they talked about. One is bringing a state liaison for each state up to the federal level so they can communicate with them on a hopefully regular daily basis of what does your state need to get these vaccines administered. And different states are looking at different things. They're looking at mass events, as in stadiums or concert halls, where they can just bring people through in these mass events and get a lot of people vaccinated. And they're also looking at making sure they get to these rural communities, these underserved communities that really have a hard time getting people to come to them. The bottom line is, what they're trying to do, which I think is a good step, is instead of getting people to go to the vaccine, which is what has happened up until now, they're trying to get the vaccine to go to the people. It's going to be helped because we have a new vaccine in the pipeline right now, the Johnson & Johnson one. And the thinking is that Johnson & Johnson, the manufacturers, are going to seek emergency use authorization probably in the next couple of weeks. They're going to submit their data probably in a week or so. The FDA will look at it, what's called VRBPAC, which, if you remember back in December, is the advisory panel for the FDA. Will look at it, and they'll give the FDA their opinion on whether they should give it the emergency use authorization. By all indications and by all the data that everybody's seen up until now, it looks like they'll get that emergency use authorization because it looks to be safe and effective, much like the Moderna and Pfizer one. Couple big differences. It's a single shot vaccine. It doesn't take 2 shots, so that's going to certainly make it simpler. And it doesn't require that ultra cold storage. It can store longer at higher temperatures. And so it's one of those things that can be more easily gotten to those rural areas, those underserved areas that might not have the facilities to have the ultra cold storage or the other types of storage that are needed. And so that's certainly going to go a long way. Johnson & Johnson has said that once they get emergency use authorization, they're getting ready to get 100 million vaccines by the springtime. And so that's certainly going to help. Between Pfizer, Moderna, and Johnson & Johnson, we should have large numbers of vaccines here, at least in the U.S., and hopefully can get more people vaccinated. Now, globally around the world, they're looking for more vaccines like the Johnson & Johnson one to come out, which can go to these rural areas. They're looking for the AstraZeneca, which can really get deep into those rural areas because it doesn't need quite the handling. But the AstraZeneca one, approved in the UK, here in the US, looks like maybe April timeframe, because they are having going through their trials right now. And so as time goes on, we'll get it under control with the vaccine here, and hopefully globally too, because that's the way we get back to our normal life. And then the last headline I want to talk about is masking. And you might have heard over the weekend a lot of people talking about double masking. Well, and first and foremost, what does double masking mean? Well, it basically means wearing a mask, like this regular surgical mask, and put it on, hopefully doesn't muffle my sound too much, and then putting another mask on top of it, and the double masking. And you might have seen at the inauguration and a lot of events where people had these double masks here. Why were they wearing double masks? Well, if you talk to a lot of experts, especially in light of the fact that this UK variant is out there and it's a more contagious variant, they're saying, if we double mask, we can certainly get it under control. But if you look deep into the data and what they're talking about, is they're talking about having multiple layers, because those multiple layers, as some experts put it, basically create an obstacle course for the virus to get through. So if you have one layer, the virus can get right through the holes, not a problem. If you have multiple layers, the virus has to weave its way through. And what they're recommending, the CDC says 2 or 3 layers. Most experts are saying 3 layers or more can help, but you want to make sure that you don't have so many layers that you have a hard time breathing. So here's kind of the bottom line for double masking. First and foremost, if you have an N95 mask, now these, we need to make sure there's sufficient quantities for healthcare workers and for frontline providers, because they're going to need these if they come in direct contact with COVID patients. But if you do have an N95 mask, this is by far the best one. 95% efficient. It can block out 95% of the virus, but it has to fit really well. If you don't have that, then a lot of people are using cloth masks. The idea behind a cloth mask, at least according to the CDC, is to have 2 or 3 layers. Most experts are saying 3 is better. And it just makes sense. The more layers you have, the harder it is for a virus to get through, or anything to get through, including air. So you want to make sure you don't have too many layers, because you don't want to restrict your breathing. But what you can do is, if you have one like this is a 2-layer system. It has a little pocket in it. In this pocket, I can put basically what's essentially makes it an N95. It's an N95 type filter in it. And you have to read the instructions on how you do it, because the letters have to be pointing towards me. So when I'm breathing in, and then you just basically put it inside here and then walk around like that. At the end of the day, you take it out. If you don't have that, the other thing you can do is you can certainly double layer. The way you want to double layer is put on your first layer, and it should be something like this, a surgical mask, type mask. This is by itself a triple layer mask, so it should be sufficient. But the other thing experts are saying, if you're in a crowded environment, like a bus or an area where you can't get away from other people, especially if you live in an area where coronavirus case numbers are very high, then you might want to think about double masking. So what you do is you put this on, and what the double mask does is, one, again, it gives you more layers to go through, but it also helps with the fit, because a lot of people have trouble with the fit. If you see a lot of people, it drops down and it kind of comes down here where their nose is exposed. They have trouble making sure it fits close to their face. If you double mask, it can help make sure that fit is more snug against your face, and that can certainly keep things confined. So when I'm talking, like I talk on air a lot, it's not going to drop as much as if I'm talking with just a single mask, where it can drop down very easily. And so you can see that double masking in some places can help. Now the other thing you can do is a mask like this, by itself has 3 layers in it and fits very well. And so again, just a variety of different things you can do to make sure that you have that mask in place. It's in place appropriately, covering the mouth and nose, and you have 2 or 3 layers. 3 is certainly better than 2 to protect yourself. If you need a double mask, that's the way you double mask. But again, we covered a few things. The variant, we know it's out there. We know it's more contagious. The vaccines and the therapeutics work well against the UK variant. At least those are the indications. The South African variant is a bit different story. It doesn't look like it works quite as well, but it still is effective. And Moderna is saying that they are starting to develop a booster shot that might be able to take in a year or so that can help with the South African variant if that becomes a bigger problem. We talked about the vaccine distribution around the country, what's going on there, and we talked about double masking. And so right now, again, double masking, you see a lot of people doing it. Do you necessarily need to do it? No, not really, but it might help in certain situations. Now let me see if you have any questions.
Can you get the shot if you're on blood thinners?
Can you get the shot if you're on blood thinners? Yes, you can get the shot if you're on blood thinners. Just let them know you're on the blood thinners, because what it can obviously do is create a bruise here, because once you get the shot, it's an injection into the muscle. It can cause a little bit of bleeding. Sometimes if you've ever gotten a vaccine, when you've gotten your vaccines in the past, they'll put a Band-Aid on there, and you notice a little bit of blood in the Band-Aid. If you're on blood thinners, that could be even more so. So they just need to be careful. Maybe keep an eye on you. Maybe you keep pressure on that area, or a tighter Band-Aid to keep it under control. But blood thinners in and of themselves do not stop you from getting the vaccine.
Are we seeing any side effects of the vaccines that have been approved in the U.S.?
So about side effects of the vaccine that have been approved here in the U.S. Right now, the main side effects we've seen are the ones that we saw in the trials, which a lot of people complain. I had my vaccine over a week ago today, and it gave me injection site soreness. It hurt a little bit, especially to the touch. That night I didn't sleep very well, because I sleep on my left side, and every time I rolled over, it hurt, and I'd roll back over and wake up. It gave me a little bit of fatigue the next day. I don't know if that fatigue is from the vaccine or if it's because I didn't sleep very well the night before. And people also complain of muscle aches, maybe headaches, but that typically goes away in about a day and a half or 2 days. Now, as far as bad reactions, there have been a few cases of anaphylactic reaction, but if you look at the numbers, the rate of anaphylactic reaction is 0.0011%. So this is far, far less than 1%. 11 people per million got this type of situation. The anaphylactic reaction, they were all treated well with the medicines they have on hand. And every place giving you a vaccine by law is required to have that equipment on hand to treat you. The CDC has come out with that saying they need to make sure they have that equipment. Now, there was an incident of a doctor who got the vaccine and within a week or so ended up dying from what's called basically TKI. He basically had a blood coagulation issue going on there. They have no idea if this is related to the vaccine, but they're looking into it. There have been reports of other people dying after vaccines, but this doesn't mean it's vaccine related. And I want to make sure this is very understandable. People are going to die after getting the vaccine by normal causes, heart attacks, strokes, the variety of issues that could cause them to die that they normally would have died in that time frame anyway. They happen just to have gotten the shot before that. So a lot of people are jumping on the bandwagon saying, wait a minute, we heard about these people dying 2 weeks after getting the shot. More than likely, it had nothing to do with the shot. Had nothing to do with the shot other than the fact that the time sequence of them getting it and then unfortunately dying a few weeks later. So you have to keep that in mind until you hear that the death was directly related to the shot. You can't really attribute those two together. And that's important because people do get concerned and scared when they hear that. But again, this is what I talked about the other day when I was on air. They're asking you about people possibly having issues from this. And let me put it in perspective. So right now, of all the millions of people that have gotten vaccines, and the last number I saw was 15 million, and it's probably much, much higher than that. Of all the people getting the vaccines, only one that we know of has died that might have been related to the vaccine, and that's that one doctor. So one out of probably 15 to 17 million people. If you look at the amount of people that have had coronavirus, 25 million, over 400,000 have died because of it. So compare those numbers. Again, 15 to 17 million have gotten the vaccine. One has died, possibly related to the vaccine. We're not even sure. Compare that to coronavirus. 25 million have gotten it. Over 400,000 have died because of it. So your risk of dying from coronavirus is exponentially higher than your risk of dying or having complications from the shot. Keep that in mind because that's the risk benefit that I always talk about that you need to look at when you're thinking about getting the shot.
Do we know what percentage of Johnson & Johnson's effectiveness?
Do we know that the effectiveness of Johnson & Johnson? Not yet. And what they say is by all indications, it's going to be very effective. And my guess is it's going to be close to the other two, Moderna and the Pfizer vaccine, just because they probably wouldn't seek an emergency use authorization until it got fairly close. What we look for in these, and if you remember back in March timeframe, we were talking about hoping that the vaccine would be at least 70% effective. And by that, we mean that it cut your chances of getting coronavirus by 70%. Well, all of a sudden we get this 95% effective at cutting your chances of getting COVID-19. Nobody thought this would happen. And so we think the Johnson & Johnson vaccine would be along the same lines. And even if it doesn't cut your chances of getting it, it can cut your chances of getting complications from it and dying from it, which is extremely important. A way we can make sure it saves your life, keeps you out of the hospital, and keeps this pandemic under control.
Can you use coffee filters inside a mask to filter out the COVID?
You know, over the months, people have looked at a variety of different filters to use that could help block it out. Anything you put there is going to help block it out. They're talking about those garage shop towels can work. Coffee filters potentially could work. Anything you put in there could block it out. Nothing's going to work as well as the things that we know that have been studied and looked at. Because the problem with coffee filters, there's so many varieties of coffee filters. You can't study one and say, okay, these other ones work just the same. But things like this, these filters that we know have certain rates of filtering out, the N95 masks that we know have certain rates of filtering out, those are the best things to use. The more layers you can get, the better. In lieu of a coffee filter, I would simply double mask.
What about about pregnant and breastfeeding women? Is it okay for them to take the COVID vaccine? Any new data on
Yeah,
that?
and this is a great question. For pregnant and breastfeeding women, is it okay for them to take the COVID vaccine? And this is an important thing to talk about. So when they did the studies, they did not do the studies on pregnant or breastfeeding women for a very specific reason. Because the way studies are done is first they do them, if you think about the phase 1 trial. So phase 1 trial is usually done on 30 to 40 healthy young adults, because those are the ones with the immune systems that we think can best handle these types of shots. And then they wait and they see, okay, was it safe for them? That's the main thing they're doing with that phase 1 trial. If it's safe for them, then they move on to phase 2 trials. In phase 2 trials, it's 300 to 500 adults, typically healthy. They extend the age group a little bit because they want to get people in there who might be a little riskier and look at it for safety and effectiveness. And they found out both these shots and the ones coming along safe and effective. Once they get that, then they look at larger groups of people in phase 3. And in this case, 30 to 40,000 people, which is much larger than most trials. Most trials are in the 5 to 7,000 range. These are 30 to 40,000 people in each trial to get these. And when they look at them, they look at them for a spectrum of ages, 16 to plus as much as they can go, or 18, depending on the vaccine, as far as they can go in age. They look for a variety of ethnicities. They look for a variety of medical conditions, people with diabetes, people with heart disease, people with cancer, to make sure that it works on them and that it's safe on them. But the one thing they don't do is they don't include pregnant or breastfeeding women, because they want to make sure that baby or that fetus is very, very protected before they start testing them. Once they realize it's safe on these people, then they start looking at the data. And typically what they find is what they found out with these trials. They found out, since especially it's a 2-shot regime, you get one at day 0 and then one at 21 or 28. Well, they found out that people in between were saying, oh my gosh, I did not know I was pregnant when I got that first vaccine. I didn't think I was pregnant. And 2 weeks later, I found out I was 4 to 6 weeks pregnant. Then they went back and looked at the data and found out that there was no harm with any of these women or any of their developing babies. So the American College of Obstetrics and Gynecologists, ACOG, came on board and they said, we want to make sure, based on this preliminary data, that women who are pregnant get the vaccine if they're in phase for the vaccine. So in other words, when it was phase 1A and it was the healthcare workers, if you were a pregnant healthcare worker, they're recommending you get it because there's no indications that it causes any issues. And we know that COVID can cause issues with the mother and the developing baby. Same with breastfeeding babies or breastfeeding mothers. They said they should be getting it because we know that there can be issues if they develop COVID, but there's no issues that we can see from the vaccine. And looking at the data, it looks like it's safe for them. We need to do more studies before we can definitely say it's authorized or approved, but at this stage they're recommending that pregnant and breastfeeding women do get it when they're in their phase to get it. In other words, when their number is called, then they should be getting it at that point. But thank you so much for your questions. As always, these have been fantastic. And looking at the headlines again, we talked about the variant, the UK variant that's out there, the South African variant that's out there, not quite as ubiquitous, but certainly something to keep an eye on, and how here in the US we need a more robust system to surveil for these, to make sure we keep an idea of what's going on out there, and so we can know when to isolate things. Vaccine is coming. The vaccine distribution is getting smoother and smoother. The administration, the getting shots in the arm, is still having a lot of wrinkles that are ironed out. And hopefully over the next couple of weeks, those get ironed out and more people are getting the vaccine. Johnson & Johnson is about to submit for their emergency use authorization. Most experts say within a couple of weeks. And then that shot hopefully will add more to the pile of vaccines we have out there, more people getting them. And then double masking. A lot of experts are talking about it. A lot of personalities are talking about double masking. And the bottom line is, if you're in a crowded environment, especially an area where COVID is very high, then you want to think about double masking if you don't have a mask that has at least 3 layers. If it has 3 layers, you're probably covered. Any more masking might cause more issues, but the mask can certainly help filter out the virus. It can help fit the mask tighter if you double mask. And if you're in a crowded environment like a bus or situations like that, you might want to think about it. But otherwise, I hope you have a fantastic week. And as always, I hope you stay happy and hope you stay healthy.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.